And what is the most surprising insight that you have uncovered in your research?
Hello again. I was very, I won't say shocked, but I do community risk reduction once I came off of the truck. I am your local fire prevention person and community risk reduction. And in community risk reduction, we see everything else as a risk, but we don't see firefighters physically and mentally as a risk. And I was very shocked about that in all of the research that I did because we're a risk. Um, my thing is that the only time we want to move the fire truck is when we're going to get something to eat. Because the less we move the fire truck, now, we know that we're going to have incidents, but the less we can move that fire truck through education, every time that fire truck moves, and me as a community risk reduction person, when I educate, I see the education, but every time I see that truck leave out of the station, I think, how are my firefighters going to come back if they get on scene, or even if they get in an accident? So the firefighter is a risk, and how much money and how much time are we willing to put into it as we do our equipment? Because I'm an equipment as well. I would like for you to value me and put some money and some time and effort into me. But then on the flip side of that quarter, as soon as we get off, and I hate to leave everybody, I'm going straight to the gym. The gym is there. You're free to go. And at 5 o'clock, or whenever the free time is, people are doing other stuff. So it is one of those things, it can be a department, mandated, situation. It can. Most are optional. And that's another thing that I found in the research, that the majority of volunteer fire departments, they don't have um, a physical, mandate or anything like that. But as a firefighter, you should know when those pants are getting a little tight. You should know a little bit to back up off the table, which is another thing. I don't have a stove at my house. I don't cook, don't want to cook, not learning how to cook. We're not going to have stove fires over here. But my eating, I have a strict eating regimen. I exercise. I always tell people I hit the lottery with my numbers. So it's a personal thing as well. But how do you, as Sarah said, how do you have those talks with someone whom you feel or who you know? And we have annual physicals every year, and that's the only time when a lot of people find out what's going on with them. My late mother would bribe my late father with chocolate cake to get him to go to the doctor. It was just a culture where my dad said he was fine. My mom said, no, you're not. You need to go. He went because he got the chocolate cake. Now, he would have got a chocolate rice cake for me, but hey, however he got there, he got there. So it's just and to me, the research on the money that we spend on other things, but we don't want to spend on the most precious commodity that we have, which is the firefighters, their mind, their bodies, and their souls.
Right, over to you, Todd. Oh, you're on mute.
Great, great overview from Lieutenant Smith. I mean, we just had here in the States Fire Prevention Week. We call it Community Risk Reduction. I can't echo enough what the lieutenant said. In fact, I've written on this recently for fire engineering, the need for human risk reduction. In placing just as much emphasis on human risk reduction. So, the question about the research, I'm going to give a shout out. I probably don't do it enough. I joke with her all the time. She's my little sister, but to Dr. Sarah Janke, I've had the honor really of being involved in so much research as a fire service advisor. to so many great colleagues and researchers. But she did a project about a decade ago that my department was involved in. It was called you can look this up online. It was funded by FEMA, the Fuel to Fight study. And it looked at 10 departments that had implemented health and wellness programs. Largely as Chief Ryan alluded to, the Health and Wellness Initiative here in the States. It's, a joint labor management approach. And 10 departments that really had not, I'll call it failed to thrive. They just really didn't invest in health and wellness of their employees. My department was in one of those 10, the ones that just, we did good entry-level physicals, maybe not even just, decent entry-level physicals, but then really didn't focus on our employees much during their career. And that was a wake-up call for me because what it found was how much unhealthier the departments that did not invest in health and wellness programs, whether that be physicals or nutrition or functional fitness or medical exams, comprehensive exams, were so much at higher risk. They were heavier. They had higher rates of preventable diseases in events, cardiac events, and so. To me, that was a wake-up call. And like I said, I've been involved. LifeScan, we just did some work with Dr. Denise Smith on, I think I mentioned earlier, 80% of firefighters that have sudden cardiac events and death have enlarged left hearts. But the majority of that is from hypertension, being obesity, overweight. It is not addressing, one, we can screen for it, but addressing the underlying root causes. So when we look at research, we've been blessed, really blessed. I want to say that for all of our researchers, like Sarah and so many others that have given us as the fire service and leaders in the fire service, labor and management, with just so much more clarity on what we need to be focusing on as leaders, and that's our people. I'll end with this. It's kind of hard to do virtually, but I do this in person all the time, and it to me, it is so powerful every time I do it. I ask a room full of an audience full of colleagues and coworkers that I'm presenting to, how many folks here have a preventative maintenance program for your apparatus? Stand up or raise your hand. And almost every person in the room, almost 100%, raise their hands or stand up. So we would never think, of putting our folks in a apparatus with bald tires, no brakes, no warning systems, and windshield wipers that don't work. It would be foreign to most all of us. But then I ask how many, and NFPA has done this more probably scientifically than myself, how many folks here have a comprehensive annual ongoing health and wellness program for your firefighters? Stand up, raise your hand. And to me, unfortunately, we still have a lot of work to do. Almost in every presentation I do, and I'm blessed to do a ton of these around the globe, like many of the other colleagues that are on today's panel, and only about, if we get 50%, that's a good number. So to me, that's inversely what we need to be doing. And for those, I know we've got a great sign up of attendees today, and hopefully with the recorded version, we'll have even greater reach. But I think the lieutenant and I are saying the same thing. Let's challenge each other to kind of flip those, inverse those priorities. And I want to be mindful. Chief Ryan said it well as a fire chief. You've got to balance a lot of things to be successful and bring the organization to a point of meeting community expectations. But I can tell you this: you don't have a fire department if you don't have healthy firefighters. and I'll just leave it with that. And I hope, I'm honored to follow the lieutenant's comments. I think we dovetailed off of each other. And hopefully there's some insight between both of our perspectives.